Hello, I'm Jessica Samuels. Welcome to A Way Forward, presented by Beem Credit Union. I'd like to acknowledge that this podcast takes place on the ancestral, traditional, and unceded lands of the Okanagan Silex people. Today's topic is counseling, and co-host CMHA Kelowna CEO Mike Gawliuk and I are going to talk about when you may want to get counseling, things to look for in a counselor, and we're also going to provide some counseling resources for you that we hope are helpful. Mike, we've talked about this before on the podcast. I see a counselor, you see a counselor. Let's start off with how you knew it was time to go and seek help in this way.
I'm trying to reflect back on the first time I would have seen a counselor. I think what triggered it for me was a relationship breakup. And I'd also gone in to see my family doctor because I was experiencing some depression and talking about the situation. And between the encouragement of my physician as well as friends that knew me and had done counseling themselves, strongly encouraged me, I'll say, to access counseling. And that's what really got me started in accessing counseling. And then throughout my life at various times, there's been different circumstances that come up where I'll go back and see my counselor, and there can be various reasons for that.
Mm-hmm.
Yeah,
right. And my experience was similar as well. You know, in my early 20s, going through, I don't remember it was any one significant thing, but could have been a breakup. You know, the 20-year-old angst. What am I doing with my life? Type of thing. But was experiencing a hard time. Like I really was not managing this well, and went and saw a counselor, and again was strongly encouraged, wink wink nudge nudge, by folks in my life, and it was a wonderful experience. I realize now that I'm very lucky that my first experience with a counselor was good. Like my first one out of the gate, I didn't even have to search around, and we're going to talk a little bit more about that. Was good, and it was so helpful. And all these years later, I reflect back on the learnings and what I took away and what was said, and just that experience, and also the idea knowing that how good it feels to feel heard and to have somebody understand what you're going through and give you some kind of solution. So, I mean, it's an incredible thing to experience if you're experiencing it well in your life. And so kind of what we want to talk about today is what we mentioned. When is it time, the different types of counseling, and then of course how to prepare and get ready for your first session or your first time going into counseling. So how if someone's going to be accessing counseling for the first time, how do they know? And this is going to be an interesting. I'm hesitating because this has led us down a bit of a thing. This was a hard one to research, so I'm a little fumbly because how do we know? First of all, it's time to go and see a counselor.
Well, I mean, obviously, in our cases, there was encouragement from others. But I think it can be multiple things. Like if there's life events that are taking place, right? It could be a breakup. It could be a loss, like a death, grieving. There could be stress related to work or your family environment. And just not feeling yourself. Like those are all reasons to go and talk to somebody.
Right. People think they need to be in crisis, but you don't.
No, I think, in fact, that's a huge misnomer, is that waiting for things to get to a crisis point to see a counselor. We talked about prevention before, and ultimately getting to a counselor when you're not, at your best, but things haven't totally gotten off the rails. can be hugely important. Seeing a counselor can give you tools to manage in the face of some of the struggles that you're having and prevent it from becoming worse. I think, when we opened Foundry, some of the reasons were, why didn't youth access counseling? One of the things was they didn't think it was bad enough. And the reality is, if you're having a challenge, it's not about good or bad. Like talking to someone about what's going on, again, a third party who's not necessarily invested like a family member or a friend would be, is super important. Going to counseling can give you some perspective on the world that you may not have had prior to, which is another positive outcome of counseling. And then, you were fortunate in that your first experience was a positive experience with a counselor. That's not always the case. Sometimes it takes a little bit of time to build a relationship with a counselor. That can take more than one session. It can take a few, right? Ultimately. So starting and building that relationship and getting to a place of comfort, or ultimately, if it doesn't work out and changing things up, is something to look at as well.
Okay.
Yeah.
And within that is also the type of counseling and the type of counselor. So we're going to do the counselor first. And this is where Mike and I are preparing. Okay. So first of all, let's just make this cut and dry. Can you tell me the difference between a counselor, a psychologist, and a psychiatrist?
I can do my best.
Okay. Thank you.
So a psychiatrist is a medical doctor. They're trained as a physician, and then they have specialist training beyond that, obviously in mental health and mental illness. They learn how to diagnose and treat mental disorders. They're able to prescribe medication. Some will ultimately do psychotherapy as well. And the other piece with the psychiatrist, because they have that medical background, they also understand the physical connection. So how that could be impacted by mental illness or a mental health disorder. Then there's a psychologist. And so a psychologist, and in British Columbia, is someone who has like a PhD in psychology. So that's usually 4 years after an undergrad degree. And they're trained in diagnosis and treatment of mental health disorders. And the difference between them and a psychiatrist is that they don't have the ability to prescribe medication, but are fully trained in a number of different like treatment modalities and assessment and have that postgraduate training. And then
yes,
there are counselors, and when doing research for this podcast, there's about 5 different registered counselors in British Columbia. They all possess a master's degree. So there's a registered clinical counselor. There's masters of social work. There's a clinical master's in social work. There's registered therapeutic counselors. And then there's Canadian certified counselors. So holy is that ever a lot and confusing.
Yeah.
The reality is they all have a little bit of different training, but they're trained, they're master's level, clinically trained professionals who go through a practicum and may learn different techniques along the way, but are absolutely 100% able to provide counseling, provide different levels of treatment to people who are experiencing mental health related concerns.
How is a person supposed to know who they're supposed to go to?
Well, that's a
I mean, I'm sitting here amazed that you know, you're someone who's been in this line of work for decades, you know, and here I am, and we're working together, and we have worked together, and we're saying, gosh, this is a lot. Imagine if you're someone who's struggling and you're like, where do I go? It's almost like you have all these options, and which way do you turn?
Yeah. So, I mean, realistically, listing off the different kinds of counselors is simply to give some perspective, right? I think certainly if there's serious concerns related to mental health or mental illness, and that would be areas where you've got like really serious concerns about depression, maybe psychosis, those elements, you would start obviously with your family doctor, because a family doctor ultimately then makes that referral to a psychiatrist. A family doctor may also make a referral to a psychologist, but you may be able to access that in private practice as well. I think in terms of looking at the different training and who's who, that's a matter of doing a little bit of research, getting a sense of who's out there in the community. And that could be through people that you know that have had successful experiences. It could be starting with your physician. It can be different ways to really find out ultimately what's available. It can be to go into a place like Foundry if you're a young person, and they may start there and see a counselor and do an assessment, who then would refer them on potentially onto another person if there's needs that are identified, right? So if someone shows up and they have specific needs and it's identified, say again, psychiatry, which tends to be the holy grail, but is not something that everybody needs. Right. An assessment can happen there, and a referral can be made as a result of that.
Right. Okay. Yeah. Thank you. and this is kind of why we were taking deep breaths at the beginning here, because this is an immense topic, and we have to acknowledge that we are just covering a part of it, because in order to cover, well, we couldn't cover all of it, and it would be a tremendously long podcast if we did all of it. So we kind of had to pick and choose what we were going to talk about when we're talking about this broad topic of counseling. Where I'd like to go now is the different type of counseling. And I would like to focus in the area of the counselor perspective. And please correct me if I'm wrong, because as I was doing this research, I would say the type of counseling that feels like it's most accessible, most present, most prescribed, most referred to is through, you know, a clinical or a registered clinical or master of social work counseling. And it's a form of counseling called CBT. Now, just before I move on, would you agree with that statement? I'm not saying one's better than the other. I'm just saying that oftentimes for folks who are addressing some challenges that they're having in their life, in the absence of psychosis and mental illness, it's CBT with counselors.
So what I would say is that CBT is a fairly common approach.
Okay.
It's got a lot of evidence behind it in terms of how effective it is for certain disorders. So CBT is something that has shown success for people who are struggling with anxiety. It's shown success with people who are struggling with depression. There are studies that have compared it to having the same impact as being on medication. It's a therapy that takes a look at your thoughts, your feelings, and your behaviors, and really gets at looking at your thought patterns and how sometimes your distorted thoughts ultimately affect how you feel and then make you act in a certain way. So it's really about shaping your thought patterns, changing your thought patterns up when, say, for example, you've got some cognitive distortions, looking at seeing things or getting an opportunity to consider different alternatives for reality, and it's goal oriented. CBT is also short term. It offers 6 to 20 sessions, but it's very active. Like there's a lot of homework that comes with CBT. You're active with your therapist, again, being very goal focused. And so there's a lot of work that takes place when you do cognitive behavioral therapy. You're always going to go home with homework. And it's not necessarily a passive where you're sitting across from someone and they're listening to what's going on. It has a purpose. That purpose is to really work with those thought processes, which shape how we behave, and ultimately, again, where it's been shown to be effective is with anxiety and depression.
Right, and I think it's important folks understand that, and thank you for that. And so, what you said there, very thorough response. It's a short definition, and I will have to read it because I want to make sure that I get it all. It's a practical, all these things you said. CBT, cognitive behavioral therapy, is a practical short-term form of psychotherapy. It helps people to develop skills and strategies for becoming and staying healthy. It focuses on the here and now. And I think this is a key thing. It focuses on the here and now, on the problems that come up in the day-to-day life. And that oftentimes will refer back to that homework and that active piece that you were talking about. CBT helps people to examine how they make sense of what is happening around them and how these perceptions affect the way they feel. Again, thoughts, feelings, physical sensations, like you said. So yeah, it's structured, time limited, usually 60 to 20 sessions, goals, homework, all of these things are specific to CBT, and it is widely used and is widely helpful.
Yeah, I mean, it certainly is. It's widely used. There are certainly some people, and I know people that have done CBT who have had really positive experiences, and it's had a significant impact on them. So it definitely has value in terms of one form of treatment that's out there. As with anything else, it's not without its critics.
I was going to say, I feel like there's a but there. Like there's a but.
Well, I think part of the critiques around it is that, again, you talk about the here and now and the thoughts that are in the here and now. Where it may be limited is what maybe caused those thoughts to begin with. So it doesn't necessarily allow you to go back and take a look at, maybe there was a circumstance that happened to you when you were younger. Maybe there was a trauma experience, and it's not necessarily going to get to that. So it's not going to be as effective, nor should it be utilized in the context of someone who's had like traumatic experiences, right? When we look at trauma, which certainly in this day and age we hear a lot about. When we look at the roots of substance misuse and addiction, certainly one of the things that is commonplace behind that is the experience of trauma. And there's other therapies that are in place that are designed to more effectively address traumas.
Right.
I mean, there's what's called EMDR, eye movement desensitization and reprocessing.
Right.
There's somatic experiencing, and those approaches tend to identify that when you have experienced trauma, it's not just a cognitive experience. Like trauma is felt in the body and it experienced in the body, and so for people that have been traumatized, those modalities have shown to make a difference for people. Now, what I would say, and how this relates back to what we started the conversation with, is that there's lots of different counseling designations out there. And I'd put up just when it comes to trauma, treating trauma, those approaches are very specialized, and they take a lot of very specific and very focused training. And so I would say if someone is looking at or looking for to address specific issues in those areas, you're going to want to ask some questions of the person that you're talking to. Like, what has their experience been? What does their training look like? Have they worked in this setting before? For how many years? All those kinds of things. Because the other side of the coin is that there are those that are out there that maybe don't have the same level of training or the same level of qualification, and unfortunately can do more harm than good. So it's important to really do your homework in terms of any counselor you're going to see, especially when we look at issues like trauma-focused work.
Right. And I think as we and thank you for that. I mean, again, I feel like we're touching on so much here, but it's really important for folks to understand or start to understand what they have to get into if they're thinking they need to seek out some help, some counseling, and the type of counseling, and which of the therapies fall into which categories, and understanding what you want. So as an example, you could be an individual who you have had a traumatic experience, but maybe you don't want to go that deep yet or at all. So it's not like you know that because you've had a traumatic experience, you have to go and get that type of therapy. And I think that's probably one of the main things I really want to get across to people. You have control. You can decide whether the therapy is working for you, the type of therapy. I mean, you can't really decide the type of therapy. You can't walk into a psychiatrist. But as you become more informed and you have the pathways open to you, you don't have to do EMDR unless that's where you choose to go right now. If you want to just start off with something, it's your first time, maybe CBT or CFBT is the way to go. And I think it's important for folks to know that they have control over the help that they seek out.
Absolutely, 100%. You choose the counselor you're going to work with, and I think this is then gets down to sort of what does it look like when you seek counseling for the first time, right? And what does the first appointment usually entail? Right. I mean, realistically, what I would say in terms of preparing for a counseling appointment is sort of to get clear around the reason that you're going to talk to somebody. I mean, as clear as you can get under the circumstances, so that you can share specifically what's been going on. Whoever you initially talk to is going to be doing an assessment. They're going to be asking basic questions around, the basics around who you are, age, those kinds of things. But we'll ask different questions around circumstances and do an assessment. And through that assessment, we'll start to identify, what's going to be suggested as part of a treatment plan, what approach may be most helpful. So it's really important to, again, not only go in with an idea of what you're there for, but to follow through with the assessment to the best of your ability. What I would say is, because it's your choice, if you go into a setting and you don't feel comfortable, it doesn't feel right for whatever reason, you have the right to stop the session and say, I don't feel comfortable. I don't want to continue. And I want to reinforce that people absolutely have the right to do that, 100%.
And also not go back. I mean, I've had friends or people in my life saying, okay, well, I think I'm good. And not because the experience was negative, but they're like, okay, I've got this homework. I've got this work. I have another appointment, but I just need to take a couple beats. And it's like, yeah, you can say exactly that. I have some stuff to work on, or I'm okay right now. Can I come back? So that idea that you have control over your treatment plan is important. Yeah. Going back to also in that first appointment, expect that it's going to be probably 45 to 60 minutes.
Somewhere in that vicinity.
Yeah. And I always find it's a good idea to, you talked about being prepared ahead of time with what you want to talk about. But I also think setting some time for yourself before you go is helpful to me. And then allowing yourself some grace afterwards.
For sure.
Yeah.
Right. It can be an emotional environment, and it can be an emotional experience. So yeah, absolutely, taking time before and after is very important.
Right. And the other thing too, just before we move on to the next point, going back to what you're saying is that really, you can seek out help from friends or medical professionals in terms of maybe where they might point you in a direction, but really do research. What I've noticed when counselors, you'll see words, and this is why we were talking about them on their websites: CBT, SFBT, EMDR. Mm-hmm. And they should describe it. They should tell you on the website what they specialize in and their areas of focus. You should see their credentials. So all of this is built out to help you to make those decisions and take the time to research it. We're Googling everything else in the world. You're about to share some or be pretty vulnerable with an individual. So
for sure. Yeah. And again, I can go to my experience because I have done a couple EMDR sessions, and what I experienced in both cases, it was two separate counselors, is that you didn't just go in and do a session. Like, this was something that built, right? They explained what it was going to involve, what it was going to take, what it was going to look like, what that experience would involve, and really prepared me for that experience to come. And of course, I did my homework in terms of who the counselors were, their history, their experience, that kind of thing, their approach, and talking about not only the positive outcomes, but where there could be negative outcomes, were things that were helpful for me to make the decision to go forward with that type of treatment. I can say for me, it was explained to me that before and after, what it would look like. And I can say from my experience, talked about it like, there's a trauma that you have in your life, and you hold a certain level of emotion attached to that, right? Whatever that trauma is. And someone explained to me that as you go through the process and as you start to process the trauma, what comes out at the other end is that you still see that experience, but the emotional intensity that you've attached to it or has been attached to it all the way along no longer exists. Mm-hmm. And for me, it was an experience that had to do with a loss in my family. And when I was done, I was pretty mesmerized by the outcome. And I could say it was super effective, because the scenario that would almost bring me to tears if I spent time thinking about it, now, after going through the process, could see it loud and clear, could still go to that space, but the pain and everything that was attached to it had been resolved. And I kind of went, wow, like this is quite amazing. And it was a really helpful and beneficial experience for me. So of course I would recommend it. Mm-hmm. But I would recommend it under the conditions that, again, it's with a qualified, certified, trained therapist, and that they've demonstrated that they've had that training and they have those credentials.
How long did it take you to get to that resolution? Because, so when you had that relief and that transformational experience that you were talking about.
Yeah, I'm trying to think back in terms of the number of sessions that I had to sort of understand the process and then the build and to do a session. And some people do more than one session. I think for me it was probably 4 or 5 sessions is what that looked like. But it's going to be different for different people based on the experience, depending on what the trauma is, how complex it is, and those sorts of things.
Okay. Well, and I appreciate you telling that story, because my hope is that it will resonate, this whole conversation, but our personal experiences will resonate with folks who are tuning into this. Have you ever had a bad experience? Have you're like, nope, this is not for me?
I'm trying to. I've certainly heard of people that have had lots of bad experiences.
Yeah.
I've had. I wouldn't say like horrible experiences.
Like I don't want to be like, oh, it was so bad.
But you kind of when you know, right? Like if there isn't a connection there, like if it's not a fit, it doesn't take long to figure that out, right?
Yeah.
And I think one of the things with therapy, and I know historical research that they've done around common factors in therapy, like what are the common factors that actually help to facilitate change? The therapeutic alliance, the relationship that's built with the therapist is always like up there. Which is
so interesting to me. Like it makes sense if you've done it, but you have to like the person. You can't think they're a jerk.
Well,
there may be moments in your session where you are disagree with them and you think, but I mean, overall, you have to like them.
There has to be a relationship that's built. There has to be a sense of trust that gets built there, a certain sense of credibility and a belief in the person's skills and knowledge as well. So have I ever had a bad experience? I wouldn't say I've had a bad experience. Have I had to make a choice where I chose to go see someone else? Yeah, and that was just because it wasn't a fit, and I knew it wasn't a fit, and there was no point going back because it wasn't going to make a difference for me.
Well, and you run the risk of rejecting what the person is saying to just because you don't have that relationship with them, as opposed to really hearing them and following along with their advice. I mean, I've had that experience, and I remember just sitting there looking at them, and for no reason, it was fine. I was just like, I don't like what you're saying. And I didn't say that. Yeah. But I just knew that I was having an emotional response to the individual. And maybe if somebody else had said it, I might have had a different response. Some other considerations too, that we have to talk about. And as we get prepared to wrap up here, is their availability and your budget. So we definitely went across the gamut of the different types of psychiatry, psychology, and counseling, and all the ones we've talked about. And we recognize that budget is going to play a big role in that. And it's no secret to anyone that, the system is woefully underserved and stretched to the limits. And there are free options out there. But even the pay services are quite, overbooked.
For sure. It goes back to one of our previous podcasts around the state of mental health in Canada, and the reality that we need a more significant investment in counseling so that the 2.5 million people who are in need that aren't getting help in the country would have access to that. So there's a reality. What I would say is, yes, there are free services that are available. Again, Foundry is a walk-in counseling model, free of charge. We've got a virtual counseling program that, again, is free of charge. There's places like Third Space, which also serve young adults that are free services, and then other organizations within the community that are either a sliding scale or free services. In terms of accessing, of course, there's the public system, which is free. And so depending on your age, certainly if you're a young person, you can start at Foundry. Child and Youth Mental Health through MCFD provides services for young people up to 19, and then Interior Health provides services for those 19 plus. Those services are free of charge. If you are through work, if you have a benefit program, you may have either an employee assistance program that you can access that would be covered through your benefits, and or your benefit may also include like paraprofessional support. So that could include psychological services, counseling, those pieces. So if you're if you're working and you have a benefit plan, I would say take a look into that too, because those sessions may be covered through your benefit plan. So there's many different ways to access help. Again, unfortunately, as we know, we need more of it. And what I know is, from my experience, it sounds like from your experience, when you get the right fit, and you're able to engage in counseling, it certainly can make a significant difference in your life. You know, I want to certainly speak to the value of it and encourage anybody that's considering it, that it can be well worth your time.
Right. Mike, thank you so much for this discussion.
Yeah, thank you.
We have covered a lot of information today. We will have some of those links on the A Way Forward podcast page presented by Beem Credit Union on the CMHA website. We'll have some links to some of the types of counseling, of course, some of those resources that Mike just mentioned as well. And if you have any questions about this topic or any of the topics we cover, you can always email us at awayforward@cmhakelowna.org. In the meantime, please take good care. Beem Credit Union supports mental health initiatives across British Columbia because caring for each other builds stronger, more connected communities. United as one, Beem's founding credit unions now serve 190,000 members across BC.